So, good morning, good afternoon, good evening, wherever you are. Welcome to another Intensive Care at Home live stream. Today is all about tracheostomy, and today I want to answer a question, and I want to deep dive into the question, how long can you live with a tracheostomy? It's a question we get all the time, whether it's at Intensive Care at Home or at Intensive Care Hotline. It's a bread and butter question for us because we're dealing with so many clients that have a tracheostomy or are at a point where they may get a tracheostomy or want to decide whether they should get a tracheostomy and so forth. So that's the topic today, and I want to welcome you all. Just a couple of housekeeping issues. So if you want to ask any questions related to today's topic, please type them into the chat, but I'll also give you the opportunity to dial live into the show if you want to at the end of today's presentation. And hopefully we can get all of your questions answered. Before I dive into today's topic, you may also wonder what makes me qualified to talk about today's topic, how long can you live with a tracheostomy? I'm a critical care nurse by background, and I have worked in ICU/critical care for over 20 years in 3 different countries. Out of those 20 years in ICU, I have also worked for over 5 years as a nurse unit manager in intensive care. I have been consulting and advocating for families in intensive care all over the world since 2013 as part of my intensivecarehotline.com. And I also own and operate a intensive care at home nursing service, Intensive Care at Home, where we provide intensive care nursing services at home for predominantly long-term ventilated adults and children with tracheostomy. So, me and my team, we're dealing with tracheostomies and tracheostomy clients and ventilation all day, every day, with clients all around the world, really. So that's a little bit about me, and if you find this video valuable today, I would also like you to share it with your friends and families. Give it a thumbs up, subscribe to my YouTube channel so you can get regular updates for families in intensive care and for intensive care at home. And as I said, please leave your comments below and I will answer your questions as we go along. Keep them on today's topic, and if not, I will answer them at the end of today's topic and today's presentation. Okay, so let's dive right into it. So how long can you live with a tracheostomy? So as much as I would like to give you a number, and as much as I would like to give you, months, years, whatever it is, the answer is that it really depends. And I want to break down to you why it depends and what are the nuances, how long one can live with a tracheostomy. So let's just quickly look at the fundamentals of tracheostomy. When is a tracheostomy being done? Most of the time, a tracheostomy is a result of a patient in ICU, pediatrics or adults, and the inability of them to be weaned off a ventilator with a breathing tube and an endotracheal tube. That's when patients end up with a tracheostomy. And one of the most frequently asked questions that we get, and I've done videos about this and blog posts, is how long can a patient stay on a breathing tube before needing a tracheostomy? So that's basically the fundamentals of tracheostomy. But we've covered that in other videos and blog posts previously on our Intensive Care at Home blog, as well as our intensivecarehotline.com blog. So that's the fundamentals. Other fundamentals are, for example, for patients with spinal injuries, high spinal injuries such as C1 or C2 spinal injuries. They need a tracheostomy because of their inability to breathe and cough, from day one of their insult, right? So that's probably the exception to the rule, but where you can almost do a tracheostomy straight away, whereas with many other clients you can wait and see whether a trial extubation will succeed, and if it doesn't succeed, then proceed to a tracheostomy. Another situation where someone might need a tracheostomy is when ENT surgeons perform a laryngectomy. They take out the larynx, often for throat cancer, and then a tracheostomy is needed as well. So what are other conditions that might lead to a tracheostomy, and why? So other conditions that may lead to a tracheostomy are conditions such as motor neuron disease, Guillain-Barré, COPD, cerebral palsy, TBI, traumatic brain injury, anoxic brain injury, hypoxic brain injury, pneumonia, COVID ARDS or ARDS in general, stroke, and so forth. Now we've got our first question here, and TS1213 asks, my brother suffered a cardiac arrest on June 23, and he is still in a deep coma, heart stopped for 37 minutes. That is a question that I will answer at the end when I went through today's presentation. I'm sorry, I want to first of all answer the question today. How long can someone live with a tracheostomy? That's today's topic, but I will answer your question after I've gone through today's presentation. Okay, so then once someone has a tracheostomy, the goal should be to wean someone off the ventilator and off the tracheostomy. That should always be the goal. Can that always be achieved? No, it can't always be achieved, which is when our service intensive care at home comes in, where we can take patients home in their own environment, where they can have intensive care treatment, intensive care therapy at home. The reality is that when someone needs a ventilator and a tracheostomy, whether it's inside or outside of intensive care, they need intensive care nurses and not support workers, not general registered nurses. And the reason I'm saying that is, if you have a look on our website at intensivecareathome.com, we publish the evidence-based home mechanical ventilation guidelines that clearly state that only intensive care nurses with a minimum of 2 years ICU experience are safe to look after someone at home on a ventilator and or tracheostomy. From experience, we have had clients that were at home and we were only funded for doing night shifts. That was for tracheostomy and or ventilation. And we warned the funding bodies at the time, the insurances as well as the families, that as soon as we leave, the clients are not safe and they could die from a medical emergency. And of course, that unfortunately became a reality, that when we weren't there with intensive care nurses, that medical emergencies couldn't be managed by families, by support workers or disability support workers, or even by a general registered nurse without ICU experience, and the clients inevitably passed away. So the bottom line is this: ventilation tracheostomy does need an intensive care nurse 24 hours a day, full stop. There's no room for negotiation, and it's evidence-based. It's come out of 20 years of intensive care at home nursing services. So you can have a look there on our website. Let's just quickly look at types of tracheostomy tubes, cuffs, and passive mure valve use. So the most commonly used tracheostomy tubes that I've come across is Portex, Shiley, Bivona. They're the most commonly used, and they're brand names. Most commonly used tracheostomies in the community in particular, but also in ICU. Some of them do come with inner cannulas. Some of them don't have inner cannulas. Some of them have a block that keeps the tracheostomy in. Some of them are unblocked. Okay, and for someone that is ventilated, you most of the time need a blocked cannula so that the ventilation air doesn't leak. Simple as that. If someone has an inner cannula, that's most of the time a good thing, because you can change the inner cannula multiple times a day. You can inspect for blockages. You can't inspect, it's more difficult to inspect for blockages if there's no inner cannula, but it also depends on whether someone has a lot of secretions or whether they have minimal secretions. You know, it depends on all of that, whether you need an inner cannula or not. Other things that can be used, especially when it comes to neuromuscular diseases or spinal injuries, and people have the inability to cough, are things like a cough assist machine in the community in particular, right? And that works very well to clear secretions, prevent pneumonia, prevent atelectasis. That works really well too, especially in the community, but in ICU as well, but you just have more resources in ICU. But in the community, we recommend to a cough assist machine, especially for ventilated patients. Next, if someone can have time off the ventilator, they should be using a pacemaker valve, a speaking valve, assuming they can talk, right? Their neurology is intact. You know, that's not always the case for patients that sustained a hypoxic brain injury, an anoxic brain injury, or a stroke. So you've got to weigh up whether someone has the ability to speak with a pacemaker valve, depending on you know, their condition, their diagnosis. Next, when someone has a tracheostomy, they should be using a humidifier and saline nebulizers regularly. They need frequent suctioning, frequent inner cannula changes. If they have an inner cannula, you should also deflate the cuff. If it's a blocked cannula, you should also deflate the cuff and potentially do a deflate the cuff and then do a suction to suction below the cuff. Tracheostomy dressings need to be changed at least twice a day, making sure the stoma is intact, no skin breakdown, needs a proper clean, you know, manage infection risk. So that needs to be done twice a day at least, sometimes depending on the level of secretions, maybe 3 or more times a day. Again, needs the skill of an intensive care nurse who knows how to manage and protect an unstable airway, because that's what a tracheostomy is at the end of the day. It's an unstable airway. Okay, then my next point is emergency management. Well, emergency management is really important. And again, this is where it comes back to the skill of an intensive care nurse. You can't just pick people off the street and quote unquote train them on emergency management of a tracheostomy. If a tracheostomy can hardly be managed outside of intensive care, and it can't be managed outside of intensive care. Again, we have evidence that patients died in the community or even in hospitals as soon as they leave intensive care, because a tracheostomy emergency cannot be managed outside of intensive care safely. And again, keep coming back to our mechanical home ventilation guidelines that are linked to below this video. And again, for example, here at Intensive Care at Home, we do train our staff on emergency management multiple times a year, or at least once a year for every staff member, so they know how to manage emergencies with our ventilated clients at home with tracheostomy. Communication in ventilated or tracheostomy patients. Again, I mentioned, especially if someone doesn't need the ventilator 24 hours a day, can they talk with a pacemaker valve? Can they potentially even talk without a pacemaker valve and just with a Swedish nose or an HME filter? Sometimes it's possible as well. But if they want to talk, the cuff needs to be deflated. If they're unable to talk, you can use potentially a leather board, or you can get them to write if that's possible at all. Again, it depends on their condition. It's certainly not easy for someone with a tracheostomy to communicate. It's also not easy for a caregiver to sometimes decipher what a patient or a client has to say. Another option that's getting more and more prominent now is definitely computer devices, of course. Some of those are can be operated with eye gaze, and we have some clients that are paralyzed, but they can operate a computer with eye gaze and they can communicate with a PC or with an iPad. It works really well. Okay, so I briefly spoke about, what conditions may lead to a tracheostomy. The most common one, and also from a general point of view, is simply that patients in intensive care can't be weaned off the ventilator within, 10 to 14 days. When you take them out of the induced coma, they can't wake up. They might be breathing against the ventilator. They might be too weak, to be weaned off the ventilator, and that's when they need a tracheostomy, because that's when you can stop sedation, get them out of the induced coma, get them more awake. But if they're more awake, it's difficult to tolerate a breathing tube or an endotracheal tube. And if they're not ready to be extubated and have the breathing tube removed, that's when they need a tracheostomy. Again, just quickly recapping what conditions may lead to that. Conditions such as motor neuron disease, Guillain-Barré syndrome, COPD, cerebral palsy, traumatic brain injuries, but also anoxic brain injuries and hypoxic brain injuries, for example, after cardiac arrest, after stroke, but also several pneumonias, COVID pneumonia, COVID ARDS, but other forms of ARDS as well, stroke. So let me now give you some case studies to explain how long can people live on a tracheostomy. So we've looked after now, so many patients in intensive care or outside of intensive care with intensive care at home to give you a very good understanding of how long can someone live. I'll give you one of our first clients we had in the community was a 69-year-old lady who was in a car accident with her husband. Her husband survived at the time, didn't take any injuries or harm from the accident, but the lady ended up in ICU with some, with multi-trauma, and she ended up with a tracheostomy. She was also undergoing chemotherapy at the time for breast cancer, and she could leave intensive care, eventually being weaned off the ventilator just with a tracheostomy. She had the inability to swallow, which is why she needed a tracheostomy, but she wasn't ventilated. Clearly the goal was for her, because she had chemotherapy as well, the goal was clearly to let her spend time at home with her family as much as possible, and it was a palliative care situation. And we were looking after this lovely, lovely lady and her family for about 12 months before she passed away at home. Bear in mind, it was a fairly complex situation from a medical point of view, with multiple trauma as well as the tracheostomy, and the chemotherapy that she had, and the breast cancer. So we kept her at home for as much as possible, and provided the tracheostomy care at home, and then she passed away after about 12 months. Another client we had in the past is, a 35-year-old man who sustained a C1 spinal injury. C1 means a high spinal injury around the neck, where, he's been paralyzed from the neck down, and he had the injury when he was about 6 years old as part of an accident, motor vehicle accident that he was in. And, he's otherwise fit and healthy, and he's lived for decades, and he could live for a few more decades on a ventilator with a tracheostomy, as long as he has intensive care nurses 24 hours a day. It's this, for some, it's not a one size fits all. A tracheostomy might have different goals for different people. For some people it might be to spend another few weeks before they pass away, and for some people it could mean decades. Let's go through a few more examples. We currently have 2 motor neuron disease clients, MND clients in the community, that are both ventilated with a tracheostomy. What happens with motor neuron disease? It's a progressive disease, where patients often end up with that disease, initially on BiPAP, cough assist, and then eventually the BiPAP is no longer enough, because they lose, similar to a quadriplegic after a spinal injury, they lose all ability to be mobile, and they lose their ability to breathe completely. So that's when they need a tracheostomy. And again, with services like intensive care at home, life can be prolonged, and patients can be looked after at home and have quality of life at home. For both of those clients with motor neuron disease, they both are in their mid-40s, and they have young families, and um, the um, the choice for those clients was either not to do a tracheostomy and to die, or to do a tracheostomy, go home with intensive care at home, have 24 hours intensive care nursing, and then spend time with their families. Isn't that a good option? How long will they live? I don't have a crystal ball. Um, you know, as long as possible. And again, with 24-hour intensive care nursing at home, it's, you know, it's much safer than with support workers. Support workers, you know, I can't draw that comparison often enough. If you let support workers or even general nurses without ICU experience look after tracheostomy and ventilation in the home, that's like flying the airplane with a cabin crew and not with the pilot. It needs specialized training. It requires years of experience, of ICU experience, to safely and competently manage tracheostomies at home or in the community, right? Other examples are that, you know, for example, after a stroke, patients might need a tracheostomy because they can't swallow. They may be able to function without a ventilator, but because their neurology is no longer intact, they might not be able to swallow or might not be able to cough. That's when they need a tracheostomy. If they're unable to swallow and unable to cough, chances are that their saliva goes in the wrong place, i.e. into the lungs, and then patients end up with a tracheostomy, right? Okay, let's just quickly take a quick break then. Let's just answer your question, TS1213. My brother suffered a cardiac arrest on June 23 and he's still in a deep coma. Heart stopped for 37 minutes. He's on a tracheostomy now and he has a pneumonia now. Right, okay. So why is he still in a coma? Is he still on sedation? Right? Or why is he in a coma? Or did he sustain a hypoxic brain injury from the cardiac arrest? The more details you can give me, the more the better chances I can answer your question. Okay, so let's carry on while I'm waiting for your answer. Let's carry on with some other case studies. We also have a client at home we have two clients with cerebral palsy that have a tracheostomy and are at home on a ventilator, right? And again, how long does a client with cerebral palsy live and how long can they live with a tracheostomy, right? One of them has lived with a tracheostomy for about 10 years. And, you know, as long as we can look after him safely, there's no reason why he can't continue to live. Bear in mind, you know, cerebral palsy, motor neuron disease, they are progressive diseases, right? And it's hard to say what the life expectancy is. A lot of it will depend on how successful we are to keep them out of ICU, because you don't want them in ICU surrounded by all other bugs and COVID and all other bacteria and viruses, right? So you need to keep them out of ICU. That's often half of the battle. So you are saying, TS1213, you're saying he's on no sedation. So why is he not waking up then? Is it because of a hypoxic brain injury as part of the cardiac arrest? Okay, while I'm waiting for your answer, another client that we looked after at home is a young lady. She was 36 years of age, and she had a condition like dystonia, muscle weakness. She had tonic-clonic seizure, subglottic stenosis, Graves' disease, gray matter, heterotopia. Very complex client to look after at home, and she was at home for about 2 years before she passed away. So again, it's not a one-size-fits-all. A lot of it depends on, you know, also depends a little bit on location as well. For example, if clients want to go home to a rural or a remote area, it's difficult to find staff there at times, right? And, you know, without 24-hour nursing care, it's much more difficult to keep patients alive. Let's call it for what it is, you know. You need 24-hour nursing care with intensive care nurses if you want to stay out of ICU predictably. So, we've had a few examples now, and I'll go through more examples in a minute. How long can people live? Again, it depends. I'll also come to some examples in a minute when patients can be decannulated from a tracheostomy, but I'll come to that in a minute. I'll just want to quickly keep going back to TS 1213, who says, no sedation. The doctor stopped sedation. He has swelling in the brain. Doctor said he won't give up. Do we have hope? And then you're saying, yes, it's hypoxic brain injury. Only the brain stem is still okay. Okay. Are you familiar with the Glasgow Coma Scale? And can you give me, if you are familiar with the Glasgow Coma Scale, can you tell me what his Glasgow Coma Scale is? And you should never give up, but I would need to know more, would probably need to look at medical records, either talk to the doctors. It's not enough information at the moment for me to say whether he'll wake up or he won't wake up. It's not enough information. It would be very helpful if, as a next step, you could give me his Glasgow Coma Scale. And you can, while I keep going with the presentation, you could look up Glasgow Coma Scale on Google and then give me the number, because it's a fairly straightforward assessment tool. You can work it out. So going back to some other examples and other case studies, I also want to talk about, when can patients actually be decannulated and have the tracheostomy removed? Great question to ask. So part of the services that we have provided with intensive care at home is, for example, some toddlers, especially some premature babies that were born at, 26, 30 weeks, ended up in NICU, in the neonatal ICU, had lung disease to begin with, and ended up on prolonged ventilation with a tracheostomy, ended up going home, after about 12 to 18 months of their lives, going home with a ventilator, going home with a tracheostomy, slowly weaned them off the ventilator. And then eventually, as their lungs were developing, as part of being a toddler, we were able to decannulate them. How good is that? So, very successful decannulation there. It's probably more difficult with adults, especially with the conditions that I just mentioned: motor neuron disease, spinal injuries, COPD, cerebral palsy, traumatic brain injuries, pneumonia, COVID, strokes. A lot of patients with pneumonia have been, can be decannulated, and it's temporary. Same with COVID pneumonia. A lot of those patients have been decannulated, but especially when it comes to neurological conditions that can't be reversed, it's very difficult to get a patient decannulated. Now, let's look at some other examples. In terms of how long can someone live on a tracheostomy, and before I go to those other examples, TS 1213, yes, have a look at the Glasgow Coma Scale. It's very self-explanatory. And as I said, as much as I appreciate your information, it gives me snapshots. It doesn't give me the full picture. It would be good if you could reach out to me at support@intensivecarehotline.com, or simply call me on one of the numbers on the top of the website to give me more information. I need to understand the full picture. What medications is your brother on? What are blood results? There's a whole, it's like piecing together a puzzle. It's a very, intensive care is such a complex area. I couldn't be talking here for an hour if I didn't have worked in the environment for over 20 years, but I need to understand the full picture. Okay, let's go back to some other examples, right? We had a client at home with a tracheostomy, a child who had a tracheoesophageal fistula, right? Basically, there was a connection between the larynx and the esophagus, right? Very complex airway, or what's being considered a very complex and difficult airway. And unfortunately, the child was also prone to bleeds, and unfortunately, the child passed away when he was about 5 years of age. Very sad situation there. But problem was also that there was no 24-hour nursing care funded, and we had warned the insurances at the time that, you know, without 24-hour nursing care, this child is at risk of dying. And when we are not there, because we were only doing the night shifts, and unfortunately, you know, the child, like we predicted, passed away during the day because a medical emergency couldn't be managed by the people that were there, who were not critical care trained. Very sad situation. And again, it keeps going back to why we provide evidence-based care. And evidence-based care means, in a home care environment for intensive care at home, to exclusively work with critical care nurses with more than 2 years ICU experience. And that's what we do at Intensive Care at Home. You know, we employ hundreds of years of intensive care nursing experience in the community. And that's a great thing. We have an amazing team working for us, and they keep our clients safe. So other examples are that we had a client, a young lady a while ago. She had a brain tumor way back when she was a child, got operated on, but then ended up on BiPAP as part of some side effects from the surgery. Ended up on BiPAP with a tracheostomy, then ended up with some abdominal sepsis, ended up in ICU, ended up with a tracheostomy, went back home with our service, Intensive Care at Home, was ventilated overnight, had the tracheostomy, and was spontaneously breathing during the day, and was due for a decannulation later in the year. That would have been around 2020. Why was she due for a decannulation? So I need to explain that too. For some patients, a diaphragm pacer might work. So what do I mean by that? A diaphragm pacer can actually stimulate some spontaneous breaths with some electrodes, with a pacer similar to a heart pacemaker. So, and this young lady was in the middle of getting a 2-stage operation done to have a pacemaker inserted, with the goal of having the tracheostomy removed once the pacemaker was inserted and functional. Unfortunately, similar to the other example that I gave you, you know, we were only funded for the night shifts. There was no ICU nurses during the day, funded but needed. And again, similar to the other example that I gave you, that the client passed away during the day because a medical emergency couldn't be managed by family or by, you know, support workers. You know, again, it keeps coming back to the mechanical home ventilation guidelines. Clearly evidence-based. You need intensive care nurses 24 hours a day. And I also appeal here to the NDIS, which is the funding body in Australia. Most of our clients are funded through the NDIS. And I appeal to the NDIS to continue funding 24-hour nursing care. 24-hour nursing care that's evidence-based for patients on mechanical ventilation with a tracheostomy. Even if patients are on non-invasive ventilation such as BiPAP or CPAP, they still need a critical care nurse 24 hours a day at home. And the same if someone is not ventilated, quote unquote, only has a tracheostomy, they still need 24 hours critical care nurses at home, just as I illustrated with my examples that medical emergencies with tracheostomies cannot be managed without critical care nurses 24 hours a day. It's clear. And that comes out of 25 years of intensive care at home services now. Other examples of clients are, for example, clients with an acquired brain injury, right? Similar to hypoxic brain injury or somewhat similar. And, you know, when they go home, they often don't need ventilation, but they need the tracheostomy again because they can't breathe. They can breathe, but they can't cough, they can't swallow. And that obviously necessitates the use of a tracheostomy so that the airway remains stable. Aspiration pneumonia is prevented. You know, those are all situations that need to be managed. But, you know, so it really depends on what the condition is for a patient. so that you can actually say how long a patient can live with a tracheostomy. It's not a one size fits all. And as you can see, it also doesn't necessarily depend on age. You can see some children can get off the tracheostomy much quicker. And then some older folks might need it for the rest of their lives. There's also some COPD or asthma clients in ICU that can't be weaned off the ventilator even after they had a tracheostomy, and then they can go home with a tracheostomy, but then it's often palliative care as well, okay, where tracheostomy then is a vehicle to provide palliative care at home, so people can approach end of life at home in an environment that is patient and family friendly and patient and family centric, right? So that's it in a nutshell, and I want to open the floor now for any other questions. I have a few more things to talk about, but in the meantime, please shoot away your questions. What you want to know about this topic or any other topic. If you have a loved one in intensive care, shoot away your questions. We can now, can now answer your questions around anything you want to know. If you don't want to type into the chat pad, you're also welcome to call in live in the show now. I'll give you the phone numbers. You should also see them below this video in the description box, but I'll quickly mention them here. If you are in the US, you can call me on 415-915-0090. That is again US, Canada, 415-915-0090 if you want to dial in now. UK 0118-324-3018. Again, UK 0118-324-3018. Australia 041-094-2230. Again, Australia 041-094-2230. If not, type the questions in the chat pad and I will get to them now. Okay, let's just look now that we've answered sort of the questions around, how long someone can live. I also want to quickly talk about, what's the quality of life for these people, for our clients. And I guess it really depends on what your view is on quality of life. It's a very subjective view. If people say, oh, this person wouldn't have any quality of life, it's not subjective, because ask the people, ask the families, ask them what is acceptable for quality of life for you. Do you want to live with a tracheostomy? Can you accept your loved one living with a tracheostomy? What services do you need? What funding is available? There are all these questions that need to be answered. But quality of life at the end of the day is very subjective. There's definitely no quality of life in intensive care, hence why we are providing intensive care at home services, right? So again, quality of life, very subjective. Most of our clients have quality of life. They're going out during the day or even on a ventilator with a tracheostomy because they have the intensive care nurse with them 24 hours a day. Some of our kids that I was talking about earlier, they went to kindy, went to school. It shouldn't stop, a tracheostomy shouldn't stop people from living their lives, assuming they have the right services and support in place. It comes down to that. It all comes down to making it safe for patients and their families. So then I talked about what is evidence-based. Evidence-based for tracheostomy is clearly the mechanical home ventilation guidelines, and I put a link below this video in the description box so you can read them. And especially in the last 2 years, almost like now 2.5 years with COVID, imagine how vulnerable tracheostomy or ventilated clients are to go back into ICU if they're at home already. You don't want the clients to go back to an ICU that's full of COVID. That's not safe. That borders on insanity, So that's why, again, it's so important to work with the home mechanical ventilation guidelines to keep people at home predictably. It would have been an issue before COVID going back to ICU from home, but now it's an even bigger issue, right? And that's what we can help our clients to stay out of ICU, because their only alternative often is to go into ICU because they're ventilated with a tracheostomy, and that's what we're preventing here at Intensive Care at Home. Also want to quickly talk about, where do we provide the services. At the moment, we provide the services predominantly in Australia, in Melbourne, Sydney and Brisbane, but we can provide services in Australia, in Adelaide and in Perth as well. So you just need to reach out to us on our website at intensivecareathome.com. We can help you with the funding. For our US audience, we're not in the US yet, even though we have many inquiries and we're talking to people in the US, but what we can do with our audience in the US, we can definitely advise you what to do if you have a loved one in intensive care. We're also providing the consulting and advocacy for families in intensive care at intensivecarehotline.com. The same in the UK. We're not in the UK yet. And again, we are providing the consulting and advocacy for families in intensive care through the intensivecarehotline.com. So you can have a look there. Okay, what other questions? Are there no other questions at the moment? I hope that I clarified today how long can you live with a tracheostomy. Shoot away your questions if you have them now. Call into the show now if you like. If not, I'll slowly wrap up today's presentation. If you have a loved one in intensive care, you should go to intensivecarehotline.com. If you want to take your loved one home from intensive care, you should go to intensivecareathome.com. If you have a loved one in intensive care, just call us on one of the numbers on the top of either of those websites. They're the same numbers. Or you can just send us an email to support@intensivecarehotline.com and we'll get back to you. If you need home care services because you have a tracheostomy or you have a loved one or you know someone with a tracheostomy that's looking for home care services, again, we can help you. Go to intensivecareathome.com. If you're finding value in this video, give it a thumbs up, subscribe to my YouTube channel for regular updates for families in intensive care. Share the video with your friends and families, leave your comments below and click the notification bell. I do these YouTube lives regularly, usually on a Sunday morning, Sydney, Melbourne time, 10:30 a.m., which is currently at 8:30 p.m. Eastern Standard Time in the US, 5:30 p.m. Pacific time in the US. I can see there are still some people here. Shoot away your questions if you like. I would love to answer your questions. And I'll give it another minute and wait for your questions, or you can dial in live on the show if you like. And you will go from there. You know what I might do because I can see there's still people here and I'm waiting for your questions. I'll just quickly show you what a tracheostomy actually looks like. That's a tracheostomy. You can see that. There's the balloon there at the end that can be inflated to keep the tracheostomy in place, avoid aspiration, right, and also avoid a leak if a patient is ventilated, okay? Some tracheostomies have an inner cannula. Now this is actually not an inner cannula, this is just a guide wire, but an inner cannula goes in and out like the guide wire, right? And again, the inner cannula is almost preventing a blockage, assuming it's getting changed regularly multiple times a day. That prevents the tracheostomy from actually a blockage. I'll show you an inner cannula, what that looks like. So this is an inner cannula, and the inner cannula goes in like that. Now that doesn't fit because it's not the right size, but basically, you take out, let's assume this is the inner cannula. It's not, but let's assume that's the inner cannula. You take it out, you inspect it, you look for blockages, and then even if there isn't a blockage, you put in a new inner cannula, right, to have a clear airway. right? And then also what you need to do on a regular basis, you need to use humidified air or humidified oxygen, depending on whether someone is needing oxygen or not. And you also need to use regular normal saline nebulizers. You can't go wrong with a normal saline nebulizer. And I want to leave you there. I want to thank you for your attendance. Thank you for your questions. And I'm looking forward to see you again next week around the same time. If you give me 1 second, I will tell you what next week's topic is. I've got it written down already. I just need to find it, and then I can tell you what next week's topic is. Next week's topic is just give me a second. Next week's topic is ventilation, tracheostomy, IV fluids, TB, and central lines dialysis. Can it be done at home? That is next week's topic, and I want to leave you with that. For today, have a wonderful weekend. Thanks for watching, and I'll talk to you next week. Take care.